Ozempic, Wegovy, Mounjaro, the GLP-1 medicines. If you have hip or knee arthritis, you're probably wondering what they mean for you. Here's my honest answer. For the right patient, these medicines are real tools. They can calm your pain. They can even delay surgery. Sometimes they make surgery even safer if you still have to have it, but they will not rebuild your cartilage. Let me give it to you straight, the way I talk about it with my patients in my clinic. Let's start with what these medicines can do. The weight comes down and your joints feel it. Every extra pound you carry around is roughly 4 extra pounds of pressure across your knee with every step. So you lose 5 pounds. That's 20 pounds of force off your knee every time you take a step. So for many of my patients, the pain improves, sometimes a lot. For some, that buys real time and pushes the surgery years down the road. And for patients who do still need surgery, getting weight down first can make you a better surgical candidate and make the operation safer. That's not hype. That's load and biology working for you. Now the other side. A GLP-1 will not regrow new cartilage. It will not reverse bone-on-bone damage to your joint. Arthritis is the absence of something. Once the cartilage is gone, it's gone, and no injection, no weight loss medicine can put it back. So if your pain improves on one of these medicines, that's wonderful. But don't confuse a quiet joint for a fully healthy one. The arthritis is still there. Keep your follow-up visits, even if you're feeling good, to make sure we're keeping track of the problem. Here's an important point. When you lose weight fast, you don't lose just fat. You can lose muscle. You probably know that by now. And your muscles are the scaffolding that protects your joints. Losing that scaffolding while your cartilage still wears down, well, that's the worst of both worlds. So if you're on a GLP-1, strength training isn't optional. It matters now more than ever. The stronger you come to surgery, say you still need surgery, the better you will do. That's true, whether you're having surgery next month or even never. The strength helps you. And now one thing I need you to hear. If you're heading towards joint replacement, your GLP-1 has to be part of that surgical conversation. These medicines work partly by slowing down how fast your stomach empties. Under anesthesia, a stomach that hasn't emptied is a real safety risk. So we stop them before surgery, these GLP-1 medicines. In my practice, that's usually 1 or sometimes 2 weeks ahead, and it needs to be coordinated with your doctor that prescribes these medicines. Don't ever change the timing on your own. Tell your surgeon what you're taking and let the team plan it together. So here's the short version. GLP-1s are a real tool, not a miracle, and not a cure for bone-on-bone arthritis. They can calm the pain, buy you some time, and even make surgery safer. They can't rebuild cartilage, and they can quietly cost you muscle if you don't train while you're on these medicines. If your surgery is coming up, make sure these medicines are part of the plan. I wrote a full article on what the research actually shows. All the numbers are there, and the link is below. If you have a question about GLP-1s and your joints, drop it in the comments. I read them all and we'll get to the answer. Thanks for watching.